this is Amanda.
And Karen, and we are co-admins at the SLPs of Color. We are an inclusive and intersectional community for SLPs, audiologists, and students.
Today we're interviewing Chelsie Esek, a Nigerian-American medical SLP based in Maryland and Virginia. Listen as Chelsie shares her experiences embracing her culture, her time at a historically Black university, and combining dance and speech-language pathology in her clinical work.
So Chelsie, why don't you introduce yourself? How do you identify?
Sure. So howdy, everyone. My name is Chelsie Esek. I identify myself as a Nigerian-American. I come from two Nigerian, born and raised. Mother and father, they're immigrants, so they actually relocated to Houston. So I was born in Houston, so I'm from the H-Town, Southern gal. And currently I went to the University of North Texas and for my undergrad degree, and that's where I double majored in speech-language pathology and in dance. So from there, I wanted to go to graduate school and have a different grad experience in speech. And I decided to apply to Howard University, the illustrious, in Washington, D.C., and I got in. So then I went to Howard for my master's degree. And so that's a little bit academia. And then as far as my personal life, currently I'm practicing SLP in an acute care setting and a rehab inpatient outpatient facility. I actually just resigned from my position that I was with for about a year, a little over a year, and I just accepted this new position in Virginia, in this hospital in Virginia. So we to that. Change is always good. It is unprecedented times right now during the pandemic. So it was just the perfect opportunity for me to switch over a new leaf and join a new team. So yes, I am now practicing in Virginia. I still do have my Maryland license as well as Texas. So that is my SLP side. I also am a dance teacher, choreographer, a bar instructor. So if anybody is in the Rockville, Maryland area, I currently teach bar and yoga and dance sculpt at this studio called Senze, Senze, bar and sculpt. So come dance with me, and I do private also. So anything you need, art or speech, language-wise, swallow-wise, I'm here to help.
A woman of many talents. Wow.
Yeah, it was a journey, and we can get into that. So, yeah.
Okay, so speaking about your journey, tell us about your childhood. You said that you were born in Houston, correct? Right?
Yeah.
So tell us about childhood, where you grew up, kind of your experience prior to the academia.
Sure. So, me growing up, I grew up in a town. If anybody listens to like hip hop music and knows the artist Travis Scott, we actually went to the same high school. So we're from this town called Missouri City, Texas. It's like kind of by Sugar Land in Houston. It's like a little suburb area, but that is where I was kind of grew up mainly. I would say my experience, a lot of my friends were American, so I never really submerged myself in the Nigerian community besides with my family. So we ate the Nigerian food, so we ate fufu, we eat rice and stew. My mom still cooks it to this day. So the food, the culture, the language. Of course, if you guys don't know, Nigeria has over 453 dialects at the moment. So the tribe that my mom and dad are from is called Edo, and it's kind of like a small town by Delta State in Nigeria. So if you pull up a map and you see like Benin City, it's maybe like 5 miles out from there. We kind of, because I know people know the Nigerian, I guess, sub-tribes as like Igbo, Yoruba, Hausa. So there's many, many other smaller ones. So my family's more so from a smaller tribe, but we grew up with the instilled. My mom and my parents both instilled, the Nigerian academics, which is a lot of people kind of cultivate Nigerians with like, oh, you guys are smart. So that was definitely one thing that was a priority in my household, academics. So related to how I got into being a SLP is my parents both own a home health in Houston, so a home health company. So I was always around nursing, therapy, minutes, billing. That was kind of, I always used to be in my mom's office and kind of be hanging around her. So that's always been in my childhood as well. One of my sisters, I'm the youngest of 4 siblings, literally the accidental child youngest. The sister above me is 10 years apart, so accidental child. But so one of my sisters is a LVN nurse. My other sister is a physical therapist, and then my parents are both RN nurses. So that's how that kind of came in and cultivated my journey to being an SLP, because I know I didn't want to be a nurse. However, I didn't want to be a physical therapist and be too physical, but I can talk a lot, as you guys can see. So I was like,
Yeah.
pathologist of speech. And then that's how I landed into it.
I feel like so many people can resonate with the things you just described, even if it's like, not interacting a lot with African Americans or Black Americans, and then having the culture really be like confined to your household, and then maybe you get to college and then you get exposed to all these other types of like
Exactly.
Blacks, and then the whole push on academia and excellence coming from immigrant, especially African parents, all the minorities. You have to be an engineer or a nurse or a doctor or a lawyer.
Right.
It's
right. You have to be something, right?
yeah, something on that list, or else like, what are you doing with your life? But
Exactly. Yeah. So you made up a good point that I identify myself as, I guess, African when I was growing up, but I never really embraced the Nigerian specificity of it until I did get to undergrad, and I was at a university where diversity was promoted, especially with ASO, which is African American or African American Association organization, or sometimes they do ASA. And it's basically a community for Africans in general. So that's when I realized, oh, I can be myself. I can be a Nigerian dancer. I can be a Nigerian person and still be accepted, not called a quote unquote African booty scratcher, or called like, oh, an insulting thing for being an African, coming from African immigrants in the States. So definitely a good point. I did immerse myself a lot in the community of Nigeria, and just really embraced my culture a whole bunch more. Then coming to Howard was a whole nother doozy of it, right?
Yeah. Oh yeah. I'll let Karen ask you that question.
Yeah, so Chelsie, you were just mentioning how you felt like you identified as being Black American growing up, but it wasn't until you hit undergrad that you felt like you embraced more of that Nigerian side. Can you share a little bit more about how you embraced your cultural roots? I feel like a lot of people might resonate with your experience.
Sure. So again, me being an artist too, especially a teaching artist and a growing artist in undergrad, specifically we had this dance class called African American Studies, where we had to study the forms of djembe and the forms of Kenya and the forms of just the different African styles of movement. So my professor one day said, "Hey, Chelsea, I'm going to be out for a week. So you're the only person of color in the course, and you're the only person I know comes from this background. So would you take the lead, and would you feel honored to teach only 1 week of this course?" So that shook my bones to the core, because it was like a twilight moment when it's like, okay, dance Chelsea, and I guess growing up Black Chelsea is now having to accept and rise to the occasion of being a Nigerian person. So I had to very much say, "Why are you afraid? Like, what, girl, what? Your Nigerian middle name is Ejime, which means coming from a good place or a good home. So why don't you embrace that and teach others what you know?" So then after that moment, I taught the class. I taught the 1 week course for my classmates. And after that, I was like, yeah, I'm Nigerian American from here on out. So that was one of my experiences. I would say was very much like, it's in your blood and you can't run away from it. It's in your colors and your skin tone. It's in the foods that you eat. It's in your native tongue. It's in your name. So why continuously still try to hide away from it when you can build off of it and be supportive with others who are coming from the same type of, shy moment of themselves. So yeah.
Was that early on, or was that like later on in your undergraduate career?
I would say that was freshman year. Yep, that was freshman year. And the class I had, it was with a professor, and he was from Kenya, and he was actually a chief in Kenya. So he would always go back and forth to Kenya and come back and teach, and then go back and forth to teach. So it was a nice experience that he left kind of sort of, because we could do our own thing in class, but he would appoint people to teach the class if he felt so. So I was one of those appointees, but changed my life forever for sure.
Sweet.
Yeah, that's
Cool.
amazing. I feel like it's such a common theme for children of immigrants to, depending on where they live, whether the environment that they grow up in embraces their ethnic background and their roots. I feel like oftentimes people growing up in a predominantly white area, not speaking on my behalf, but I've had friends growing up in the suburbs in predominantly white areas, they almost reject their ethnic roots, right?
Yeah.
The food, they don't bring it to lunch because all the kids are gonna mock or bully whatever they're eating.
Right.
It looks. And then it's like, why do I want to introduce you to how I grew up, how my parents are you going to mock their accent too? Or so it comes down to like the attire, your food, everything that makes up that culture. It's so interesting. And I'm really happy to hear that you actually had that experience starting your freshman year instead of later on in your college experience, because I'm sure that probably helped define your background too.
It did. It helped define me as a person, as an artist, as just a being, as like, what do I identify with? How do I identify? And lo and behold, from that moment of acceptance that I had with myself, I allow my I guess my realm of knowing to be spread out. So now I know so many Nigerians from UNT, so many Nigerians from Howard, and I don't think I would have had that same experience if I still would have been like, oh, I'm Black from Mo City. No, girl, you're Nigerian from Missouri City, Texas. So that's the big difference.
Yeah. Do you feel that experience kind of influenced your decision to apply to Howard? I don't know if you applied to a lot of HBCUs in particular for a specific reason, or if you cast a wider net, but kind of what was your decision-making process when it came to applying to grad school?
So as far as my application to Howard, I think what I'm just trying to put myself in the mindset at the time. I know that I didn't want to apply to just a regular quote unquote PWI for graduate school. So Howard was one of the many HBCUs that I did apply to. However, yes, definitely that experience of me like coming into myself freshman year was the driving force for me trying to be the minority in the room purposely. Yes, for sure. I definitely always try to make it known that I am African, I am Black, I am a minority, I am here. But if more so, I would say the application process in itself allowed me for the more, how do I say? For instance, my letter of interest was all about my grandmother and how she named me Ejime. So I would say that experience was more so my catalyst to, okay, girl, apply to everywhere and show them who you are as a minority more so. Not just Howard, especially. Howard was one of the places that I did apply to, but the application process itself, I knew the perspective I wanted to go into with the application to show who I was as a candidate. Like, this is me as a full-blown Nigerian, double major, graduating in 4 years when the supervisor told me that I would graduate in 6. So it was me coming into my full self as like acceptance, like, okay, I'm going to apply to all these schools and show them me. That's how my mindset was at that point, for sure.
For sure.
So rolling back to, you spoke a little bit about how you came to choose Howard. Going back into your undergrad, I know that you talked about combining dance and speech pathology. Did you come into your undergrad double majoring, or did you start in dance and then you found speech? And like, how did you, so 2 questions, how did you come upon the field, and how was your undergraduate career?
So it's funny because in high school, I've been dancing since I was about 6. So I knew I would always keep it in the realm, rather it be academia, rather it be personal, or however, teaching, I knew I wanted to keep that. So going into college, firstly, I think my first decision was making sure they had a good dance program, and then having speech pathology was second. So good question. I've never had anyone ask me that question. So definitely dance was a priority, but I always kept speech in the back burner for, again, what Amanda was talking about, how your parents want you to be an engineer or a doctor or something. So I wanted to keep that to make money, to not be a starving artist, but it catalyst and turned into what it is today. So I definitely wanted to come in freshman year being a double major off the top, off the rip. And I remember like it was yesterday, I went into that advisor's office and she looked at me and was just like, you will not graduate in 4 years. You will graduate in like 6, maybe 7. But there's no way you could do it. So as soon as she told me that, I was like, no, absolutely not. And
Thanks.
I grad and that's all I remember saying. I was like, nah, like that's it. So from that point, again, motivating factor, being a challenge, and every semester I took 24 credit hours. Every semester. I did every mini semester. I did every I
Oh,
did every I did every mini semester, every semester, every summer, every winter semester, whatever you want to call it. I was in all of them because I wanted to get out in 4 years because of that one moment. Again, an adversity that I had, and someone told me I couldn't, and I did it. So, yeah.
I applaud you.
kudos to
Good
you.
for you. Yeah, seriously, that is an achievement, not only to do it in one semester, but to do that for every semester.
Yeah.
How
It
did
was,
you how did you manage that?
I definitely would say I was in my books, and I was either in rehearsal for dance or I was either in a class for speech. It was one of the two. For instance, it was to the point that I had a class that ended at 4:50, and then my dance class started at 4:45. So I would literally run from the science department and like be in my leotard in the hot sun, trying to be ready at the bar, ready for first position. So
Oh,
it was a lot. It was a lot. I'm not even gonna lie to anybody who isn't mentally strong enough and mentally disciplined, who has phenomenal time management skills. You have to make sure you're on all these different projects, especially during the last few years of college. Your junior and senior year. It's like all these tests you have to take. If you wanted to do a graduate degree, you have to think about that, application process for that. So it was more so like, okay, she told you couldn't do it, so you have to make sure you can. That's the mindset that I
do you feel like having your parents, did they go to school here in America to become nurses, or were they already like qualified that wherever they were from?
Yeah, so it was my mom and dad both did I would say in Nigeria they have something called like secondary school, primary school. That's how they kind of quantify educational levels. So they both finished basically their freshman year of college in Nigeria, but they came to America and finished the rest of their degrees here. So my dad actually I think my dad has to play a factor for me trying to be an overachiever because he's also an engineer and a
Oh
nurse.
my,
So yeah, so him too. I didn't even realize that until I got older. But that he also played a good factor in instilling that. But I would say my family really, how do I say? It's almost like an unspoken standard in the Nigerian community and households that school, that it's the only priority for you. So it's like my parents didn't have to really scold me about school or really check up on school because they know that was, again, the unspoken standard that we put you through school, you're in school, at least that's what you can give your parents back for what we've done for you.
yeah. So did you feel prepared going into undergrad? I know that like personally like my parents didn't navigate academia here, and I still feel
Mm.
like I can't navigate academia as well as other people, but did you feel like having your parents and your older sisters having gone through that process, like did that help you feel more prepared and getting to the grind when you did go into school?
Definitely, you hit the nail on the head with the older siblings. So having siblings that are so much older and experience everything that you haven't experienced yet. I always tell my friends that I felt like I had 6 parents because
Mhm.
my sisters, when I was in high school, my sister's friends would be like the coaches or like the teachers. So I was never, again, too far away from my family's eyes, basically, because everyone in the neighborhood knew each other. My last name is what I go by a lot, Esek. So Esek Health, Esek whatever. So a lot of people know us back home. So that was always like another pair of eyes. So my siblings kind of navigating that college experience already, especially my older sister, she went to Texas State in San Marcos. So she definitely, and that's the physical therapist. So she kind of took the reins and was like, you're going to do everything I did not do right. You did it right. So she was mainly also there, kind of guiding me through the process. But, you know, I am the youngest, so I like to do my own thing because I'm hard headed. So that too. Yeah, for sure.
Awesome. So then I guess more into kind of going back to what Karen was asking in terms of coming upon the field of speech. You touched upon it a little earlier that you were like, I don't want to do PT. I don't necessarily want to be a nurse. Like, how did you even find the speech field having those experiences and coming into college?
So it takes me back to my mom's home health. I would kind of help her go through charts sometimes, and it would always be like my mom would write like PT and then OT, and she would write ST. I never knew what ST standard for a while growing up. So I was like, okay, ST. And then I just kind of researched it on my own. This was maybe about ending of high school is when I found out about the field, really. So my senior year of high school, and then I was like, oh, a speech therapist. And then I just researched like every kind of how everyone else does when you softly hear about something or a new career path. You Google it, see what comes up. But then I was connected with my sister knew a speech therapist in Houston, and I got to shadow her. It's funny because she works with P's, and that is not where I am now at all. But just the passion that she had with writing a plan, figuring out after giving an assessment, a piece of paper on someone's deficits, and then creating a plan to help this person get to where they need to be. That whole intervention process is what I fell in love with. So from that moment, I was like, oh, okay, I see what she does. It's not just a therapist, but you're a pathologist, right? You find what we do, what someone is doing wrong or bad or can't do, and we help rehab to that point. So I was like, okay, researched it. Then again, took me to my what has a dance degree, what has a good dance department, and what has a speech department. So that's how it brought me to making sure those ideals were still prevalent for both.
Right.
And then kind of attacking those two at the same time.
Sweet.
Could you share a little bit about your experience at Howard, going through the grad program, your positives, just going through clinicals, practicums, and what did your cohort look like? You feel like it reflected Howard's values and mission? How did it go?
Good question. So a lot of my cohort members now you guys probably know a few of them. Me and JRC, the SLP, are currently roommates. Like we're roommates, so we're really close. And she was in the class with me. A Diamond, the SLP Ray, also was in the same class as same cohort. So we were very close. And you know, of course, during these experiences, when you get into the job, we realized that, oh, we needed a year to figure it out for real. Like everything that we learned in grad school was so bookwork and so paperwork that the application of us being into the field during our CF year, everyone kind of like took a little hiatus from each other, which is natural from a cohort class. You know, you get together whenever you have time, right? So, but they're all doing well. They're all doing well. As far as my experience and how, me personally, a lot of people like to say culture shock. For me, it was just culture acceptance. It just was very liberating to see a celebration of Black minority people in one setting. Every day at Howard was another celebration for something. You know, Howard homecoming was a really big thing. It's still a big thing. So just finding my ground, my basis as a Black clinician in DC at Howard was a phenomenal experience. And I would say anyone who's interested in going to HBCU, please do it because it changes you completely. your scope of practice is now even wider because you not only are focusing on the application of the clinical work, but you're looking at, again, health disparities. You're looking at, again, populations that aren't represented. You're looking at, again, just the large scope of people of color in general. So that's my HBU soapbox. But how I kind of got into my acute love and my acute setting was actually at Howard Hospital, University Hospital. My supervisor was Annette Hines, and I did a post about her, about one of the people who inspired me on Instagram. And she just kind of reintroduced for me, I guess, since I had some experience with home health back in Houston. She reintroduced the importance of acuity and understanding how to treat. So she was very, very, I would say my pivotal moment in my career by introducing me back into the acute setting.
Great. How many clinical experiences did you have at Howard?
So at Howard, we had every semester, it's 2 years, and you have 3 rotations per semester. So you have a spring, you have a summer, you have a fall, and then you have a spring. So that way. So I first started at Howard University Hospital, and then they, of course, have to switch you around. So then I was at a private practice, and then it was like a private practice / kind of like an intellectual disability center with middle age to teenage, kind of, sort of. And so then I went back to, so after that was our senior year, and or our last year in the department, and you can pick whatever setting you want. So Howard was definitely good at giving different tracks. So we had a bilingualism track, we had a medical track, school track, and an AAC track. So depending on those tracks, you could just kind of choose which placement you would want. You have like a top 3 placement, and then our clinical director or supervisor would place us. So I had Howard, and then I had the school, and then I went back to a hospital in DC called MedStar Washington Hospital Center. That is where I would say when everyone has their, like, when you get your nails done or something, and then they put on that last coat of polish, that is how that's how I felt. Like when they put on like the last clear coat, and it's like, okay, put your hand underneath it, and you're ready, right? You're ready. That is what MedStar Washington Hospital Center was for me. It was a 952-bed trauma hospital. So I saw an array of everything possible, to GSW, which is gunshot wounds, to malignant melanoma, to metastasized melanoma, everything possible, trach and vents, which is my love, everything is what I saw there. And then that's when I jump-started into my now evolving career.
Yeah.
Since you were able to choose or go down the path of medical, how was your CF experience? Where was that?
So my CF experience, I wanted to take a hiatus from the acute setting and try kind of like a rehab hospital inpatient setting. So a lot of people don't really kind of know the difference between what's a hospital or a rehab hospital. So a hospital, of course, is you can go in, call 911. You have kind of any injury or any clinical presentation, you can walk into any hospital. A rehab hospital, you have to kind of get a referral from a doctor from a hospital and kind of see a need for rehab services. So, for instance, let's say I had a surgery on my leg, and my hospital stay time, my acute hospital, like the main hospital I'm at, the doctor's like, hey, your time is pretty much up here. You can't go home because your leg is still swollen or your leg is still bleeding, but we want to send you to this other place where you can get acute treatment. So this is that's how I kind of got into that setting. So I did that it was a place in Silver Spring, Maryland. I was there for, of course, the 9-month period, and it was nice. My supervisor was not really present a lot; she was remote. So a lot of people have that experience when their supervisor is always on site with them, and you have, one-to-one, but mine was very much tele and virtual. So I was the only SLP there. It was a 116-bed unit. So I was the only one there, which I was actually happy about, because I got to learn, fall on my face, make protocols, be in meetings with DORs, directors, talk about rug levels, talk about minutes billing, talk about frequency, all of that on my own. I learned a lot by, during your CF year. And that's one advice I always like to give people is, this is your last year. You can make mistakes. Let this be the year you make a lot of mistakes, because after that, there's no one there to help you. And I know you know how Asha puts people on blast, and you don't want to be put on blast. So, yeah.
Wow. How did you, I don't know, are you the type of person that's like okay with being thrown into the fire? I feel like one of my like anxieties about finally starting in the work field is like being tossed into like a full caseload that's like the only SLP with a 116 bed unit. Like, how did you even handle that, you know?
So, right. So I think, and this is, it's all funny. It all connects now that I'm even talking about it and having the time to reflect with you guys on it. Is it all goes full circle to the mentorship and the guidance that you have when you first start off in this field. I think it's so important for people to connect with others who are real in the field and who can tell you what not to do. That is where I was like, please tell me where the phobias are. One of my favorite interview questions I like to ask the companies, or I ask whoever I'm being interviewed for, is, what is one mistake that a clinician or a therapist has done that you wouldn't want to see do again? That right there is the biggest feedback for me. Like, do what not to do so you can learn how to do it correctly. So taking me back to Mrs. Hines at Howard Hospital, like you said, Amanda, she's the type. I used to have things planned out for therapy sessions to the T, and she used to say, Chelsea, drop that, put that binder down, and me and you are gonna walk up to the third floor, and I'm gonna just stand right here. And she used to literally stand and watch me. Just, I wouldn't know what the heck I was doing, but she would literally just say, Chelsea, like, no, like, the patient did this. What are you gonna do? And that's how I learned. I used to grind my gears. It used to just, I used to not stand it. But as I was done, as each day I would feel more and more confident on the floor. Like, oh no, Miss Hines, I got this eval. You don't have to go with me. That from that very moment, that's how she kind of instilled that. Like, just drop it and go, because that's acute. That's acute care. That's inpatient, outpatient care. Anything can happen on a drop of a dime. So you have to be comfortable with just quick on your feet. If those notes aren't there, what can you do? And I'm glad that she kind of taught me that way, because I'm a writer, like all SLPs are. We like to write, plan, do all those things. But if you don't have your paper or your clipboard and your patient is coughing on that bin you just gave, what will you do?
Mm-hmm.
So, yeah.
Do you see yourself going into any other niches in the fields? I feel like you're like, from what I'm gauging, you're like med SLP all the way, like trachs and vents, like. But if you had like the opportunity to go into another area, do you think you would? What would it be?
Good question. I think if anything, I would just try to kind of hone in on or connect more with a lot of art therapy and mindfulness therapy and music therapy. That's the only other niche that I think I could see myself doing. Besides that, I love the adolescence population. When I was working or when I interned at that facility, was great. I love the high school kids. They're cool. But besides me having another niche, I would say I would just want to grow more and teach others, and be a stamp post for others in the medical SLP world, especially those minorities of color, because it's hard for us out here. It is.
Understandable. Totally understandable.
It is.
So since you were sharing a little bit about dance and speech pathology, tell us how you've combined your two passions, because I know that you just mentioned about art and movement therapy. Can you expand on what that is exactly?
Sure. So music therapy or art therapy is basically using any form of artistic expression to enlighten or to have someone just be rehab from, again, where they're feeling. If you are, let's say, art is also using an expression for either verbal communication or totality communication or however. Music, a lot of people love mindfulness and music therapy because it helps with mood and motivation. I use that a lot in my therapy. For instance, that's how I build rapport with a lot of my patients. Let's say they see, most of the time an African American person walk in the room, they're almost a little hesitant already, especially if you're waking up from coma or whatever you're waking up from. So sometimes I like to say one simple question: what's your favorite song? That one question alone can just kind of, oh, we're in the doctor's room or I'm in the hospital bed and she's asking me my favorite song. Is my song going to play? And most of the time it does. So for me, I like to take my iPad and just introduce people to the idea of mindfulness and music meditation. So it's mainly playing music, mainly being mindful of what you're hearing, mainly using art and sounds and music visualization to just improve mood and overall quality of life during the times of acuity. So art therapy can be, a lot of people, SLPs use art therapy every day when we tell a patient to, hey, draw a clock. That is art therapy, right? Using the mocha. So just having someone having an existential feeling or existential emotion based off of art itself. So that's what mindfulness and art therapy, at least how I try to bring it in my practice. The ones who are also in PT or in OT, using dance, of course, crossing across the midlines of the hemisphere of the brain can help a lot with mobility on the weaker side or on the whatever the paresis side is. So dance can help with, again, mood, muscle strength, of course. Dance history is another thing I like to bring with my aphasia people, because some people do know who Martha Graham is or Alvin Ailey. So just throwing those little artistic terms, because you never know what some people know post-morbid or who don't know. So a lot of people like to just talk about art because it makes it feel good. It makes therapy feel better.
Yeah. So you mentioned that you're transitioning, or have you already you just resigned from your last position, correct? And you're going to start up at a new facility. Can you tell us a little bit more about what you're going to be doing, if it's that much different? I know you mentioned a little bit about it, but if you could expand.
Yeah. So this place is pretty much the same, but this place is 307 beds. So the place I just came from was, I believe, 250. So a little bit bigger. It's the same thing, same type of inpatient rehabilitation hospital. So this place has designed a specific PCU unit, which is a trach and ventilation unit. So I'll be working a little bit more with my favorite population there, which I would say is always a good thing. Always a good thing. My next thing I'm going to try to start investigating is using a humming method. So I know humming is also phenomenal for voice and working with trachs and ventilators. Of course, you have dysphagia, and then you have vocal adduction deficits. So using the humming technique to their favorite song would also be one of my next things I want to investigate with that population. Of course, building on to the movement therapy, mindfulness therapy, doing as much art as I can as well.
Cool. That'll be fun. You get to work with your favorite population in
in a
that's all.
specific,
I feel like a lot of people don't get to do that, like in a specific unit. I was at an acute rehab for one of my placements, and I was just like on the brain injury unit. So, and I like brain injury a little bit more than like the aphasia stroke. So I was like, oh, this is a thing. Like I could be in this specific unit,
Yeah, that's new for me too. Of course, when you get a couple of orders or referrals that come down from doctors or whoever, and it's like, oh, passing nerve valve, eval. That's fine. Of course, I always will take those, but just being in a specific unit again just adds more spark. So I'm excited.
Cool.
So on the topic of now transitioning into a new job, following the similar tracks that you were already doing, but still with a little bit of a focus on trach and vents, which is what you're interested in. How has your experience been during the pandemic? So you talked about how you gotten off work early today because it was on a low census. How has that impacted?
So The pandemic has been the scariest blessing. Let me just
Mm,
say, it has been the scariest blessing. So I'm going to speak on kind of the not so good part of the pandemic that I experienced. So I was at a facility, and unfortunately, they did have a COVID outbreak, um, and the facility was not equipped to handle that. So, for instance, it was, I believe, a 120 bed facility, and the census dropped to 87, and most of those were from fatalities due to COVID. So, and just put it in context, some of those patients I work with who died, um, I mean, we worked together maybe for 4 months just so they can be on a mechanical soft diet. And you see this rage of virus that just came into a facility, literally took lives of people who you worked with and left with nothing. So definitely to speak on the pandemic in facilities, in healthcare facilities, it is a real thing. It is a very sad thing. And I, once again, myself, a healthcare worker, the healthcare workers, thank you for doing what we're doing, because it was very much a real life real life scary movie that I lived through. For instance, just to put it in a little bit more context, I had a patient. She was, I believe, 87, and her presenting diagnosis was pneumonia, a UTI, and COVID. And I went in to, of course, do a swallow eval for her because the family just wanted to, end of life care to see if she can have some water at least. And her pulse was 32, and the average pulse for a human is between 90 to 100. So she was at 32. Um, so just putting in context that type of drastic changes with patients who you saw last week who are doing phenomenal. That was not that's something that I wouldn't wish on my worst enemy. So just speaking on the pandemic itself, um, I pray that the universe, that God, that something just pulls America and the world out of this, because people are losing their lives due to this. So that's just on the pandemic. As far as work and caseload and PPE, it's hard. You have to stay protected. Every day I'm drinking a gallon of water full of ginger just so I can make sure my immune system is maintained optimally. Um, census again is up and down. Some places are moving into phases. Some facilities are moving into phases. So right now, I believe most of them are in phase 1 to 2 in Maryland and Virginia and DC, which is now families can have only one visitor per patient, which still you have to both have masks on, both 6 feet away. But now patients and their families could see each other after 3 months of no contact. So that's where it is now. The census is kind of up and down. People are still getting sick. COVID is still here, so we do see COVID patients still. We do have to get tested weekly,
mm.
nasally, which is annoying. So nasopharyngally, basically just picture getting seized every week. Basically, that's how it feels. Um, and yeah, just of course PPE, 60, the whole shebang is still alive and well in the settings that I work in. Um, it was just very a pivotal point in my career that I've never seen as many fatalities as I did in 2 months in my whole entire career.
That is a
Yeah,
lot.
it's
You said, shout out to you, because you and everybody else who's working, even you, Karen, like everybody who's working and going out right now, you guys are like superheroes, honestly. And it's
yeah,
like, I just wish you guys all the best and all the health that you can have. I hope the ginger
yeah,
works optimally for you, your
yes.
water every day,
I have it right here.
Yeah. Oh, yeah, that sounds really anxiety inducing. Even like my
Yeah.
mom, she works in the medical field, and she's been like, the other day she's like, I had an anxiety attack. She couldn't even like get up out of bed. It was so difficult for
Oh
her. I'm like,
no. Yeah.
I can't even imagine having to go through that every day, wondering who you're going to see, what's going to be their, position or their predicament, and how it's going to affect you, and having to try to do therapy with all these precautions in mind. It's tough, for
And
sure.
for me too, it was more so, a lot of facilities had an outbreak. Unfortunately, the facility that I was kind of part-time working at, they weren't equipped. So meaning once the census drops in a facility, so just a little bit of background about SNF and rehab hospital, I guess, numbers and administrative. So every facility has a certain amount of of beds, right? So each bed has to have at least 70% occupancy. So if there's 70% full, you're in good standing. If you're below 70, that's when the big bosses kind of look at and say, hey, what's going on? So the facility that I was working at dropped below 70%. And with that, that means there's no money for no staffing, adequate staffing. So when there's no adequate staffing, meaning there's no nursing, there's no GNA, there's no respiratory, who gets affected? The patient. So the patients can't be moved when they need to be. So there's bed sores that the bed sore count is accelerating. The UTI count is accelerating. Dietitian isn't there. So it was just a spiral of negativity that started to happen, which affected my patients, which affected their motivation for therapy. So it was just more so I wish that it didn't happen here because they couldn't handle it. But how would they avoid it? So that's just a little background on the pandemic nightmare.
Yeah, and since you were mentioning about getting swabbed every week, I know that it varies state by state. At my facility, we have to get swabbed every week, but the turnaround is we don't get to hear our results until Thursday or Friday. And they're testing all of the employees and all of the residents that live in the facility. Then that's specifically in my facility in Illinois. What is that? What did that look like for where you're working? And then my follow-up question with that is, we were talking a little bit about PPE and not having the adequate equipment. Did that affect your decision with where you found your next job since you had just resigned from your other?
So yes, so it was more so, so the part-time facility I was working at, they had PPE. It was more so for me, just the patient care. So when I'm such a sucker for the work that I do, and I just love making sure that, therapy is hard, especially for our patients. It's hard. I want my patient just to be focused on getting better with therapy, not getting better with nursing. So for me, it was more so that nursing staff and the hospital was not staffed enough to make sure the patients were okay, legitimately. So, like I said, it would be one nurse to 25 patients, one GNA to 15 patients. That's not safe. That's not healthy. That's not okay for my patient. So that was one of the reasons why I decided to officially kind of resign from that company, because it was, and then when the state of the department, or when the state of, health, board of health starts to investigate what's going on with that facility, that's when I think you should, say, hey, my license is in jeopardy. I don't feel comfortable working here anymore. My morals and my morale is not aligned with the company's values anymore. So that was when it was time for me to resign from there. So here at my new place, yes, there's COVID testing every week. There are no COVID patients currently at this new hospital I'm at, as well as they did have an outbreak. But of course, that building, the new building I'm at, they were equipped to contain it. So even when they did have a COVID outbreak, unlike the previous, they couldn't handle. My new place is well equipped to handle, and which they did. And now they have 0 cases. So just something to think about for therapists. And a lot of therapists don't really talk about the journey of changing jobs a lot. That's going to happen a plethora of times in your experience. It'll be a place where you thought it was okay, or a school that you thought the values met yours, and then long down the line, administration makes you feel uncomfortable, or the pay, or the hours, or something. Do not be afraid to protect your license at all. And I got this advice from my mentor, and it was the best decision, because now I feel like a door opened up for me. That's something better and safer. So definitely remember that. If you feel, the director of rehab is making you do things that are unethical, it's okay for you to resign and protect your license. It's fine. Trust me. The SLP world is small, but it's also big at the same time. So you will find work. We are always needed. Just the pick and choose what's right for your morals and your values, for sure.
Yeah. So switching gears a little bit back to kind of your identity and how you navigate the field. What are some things that have impacted you as a Nigerian-American SLP in this field, whether they be positive or negative? What about being a Nigerian-American SLP has made you see things and decide that you want to make a change for the better, or what would you like to see changed after navigating this field and academia, I guess, too, as a Nigerian-American? I know that's like a really low, and so if you need me to repeat it,
No. I'm just, no, you're fine. I'm just trying to find the angle I want to answer this question. So I'm going to speak in it twofold. The first fold is I'm going to speak on just healthcare and representation within our field for Black SLPs, and then I'm going to speak on our patients who are the same color as us, who are going through a different type of adversity. So the first thing is I would love to see more minorities of color, more people of color in the field of speech pathology. So that's just in general. That little 8%, 4%, whatever the number is now, needs to be up there at 85%, because that will help in general with this conversation here. It wouldn't be so foreign for people to have this conversation about inclusivity. So that's just number one. I would love for that to be just a new revolution in the field, that yes, we have way more people of color than we did before. That's number one. For me, what I've experienced as a Black Nigerian-American speech-language pathologist in the United States is when I walk in a room full of residents or MDs or nurses, and they look at me and call me either sweetie, call me baby, or just kind of dismiss my whole existence because, number one, I'm Black, and number two, oh, are you a nurse or are you a GNA? So for me, I just want people, experiencing that as many times as I have already, working in a plethora of medical settings. What I've noticed that helps and eases it is putting patient first. So let's say I do walk up to a resident who's just like, oh, like, who are you, or what do you want to talk about, or just being very dismissive in his overall aura. Speaking the jargon that you need to speak, or saying what you need to say, or being good at your work, doing good work, being a good A star speech therapist, making sure your documentation is on point. They can't have anything to say about anything you do. So for me, what's always pushed me is like, okay, so they're playing the Black card, or they're playing, they're playing like I'm the Black girl in the room. I would make sure that the talk that I'm saying, like, hey, did you know this patient is on X, Y, and Z, or this, or, oh, I didn't know that. Thank you for letting me know. Or did you know that I'm the speech-language pathologist who can tell you that your patient can swallow or not? Oh, I didn't know who you were. Just introducing yourself and having that conversation about what you do, and explaining how you do your work well. That's always been my saving grace. Although my color may not be the same as yours, I bet my work is better than yours. So that's just my thing. And being as a Black woman, you have to make sure, yeah, we're already Black, yeah, we're already minorities, or yeah, I'm already Asian American, or yeah, I'm already Mexican American. Either way, we have to put an extra step forward regardless. So if work starts at 8 o'clock, I'm always at work between the hours of 7 and 7:30. Why? Because I just want to be. I want to be there. I want to be, prepared for work. I want to show you that I'm not just here being the Black SLP and, just not doing anything at work. No, my work shows precedes me, basically. Your work has to precede you. So, yes, she's always there on time. She comes to work early. Her notation is always done. She's, she always knows what's best for the patient. She communicates with the family. She builds rapport with the patient. Then your color of your skin doesn't matter if the work ethic is not the same. That's my experience that I've pretty much always experienced, even till this day. It's just I have to always wear the badge of armor. Okay, I'm just gonna go in and do what I need to do for my patient, and you'll see my documentation, and you'll see my note, and you'll finally know, oh, I do need a speech therapist to help me tell me if this person can swallow or talk. So just making your work be valuable in your work.
Yeah, I feel like we hear that a lot from people, that you kind of have to wear that, and like they say, you have to be twice as good, and you
You
kind of
have
have to
to.
put that best foot, like before they even know your name, you have to like make sure all your T's are crossed and your I's are dotted, just so that nobody has anything to say about
Yeah,
you or
yeah,
your work.
yeah, exactly. Because the worst thing that we can do as minorities is do a lazy job and prove everything they're saying about us right.
Yeah,
Does that make sense?
give
We don't
them
ever
to
want to
say.
have exactly. We don't ever want to have that stigma when we already have that stigma alone that we're trying to fight every day. So
I'm trying to hold on to what you just said. That was a lot to try to
I
process.
I know.
And you know what? I
But it's
feel
real.
like, yeah, but it's real. And especially being a Black SLP in the field, not just being in the field, but in a medical setting. So, and I feel
Yeah.
like it's so often that I've um, seen people talk about their experience about being in the medical field, and like you were saying, being called sweetie or dear. It's so belittling to your work and how hard you strive to get where you are today, and for
Right.
to assume that you are a CNA. And you know what? CNAs are hard workers. They do
Yeah.
the
What?
dirty work. They deserve the
Nothing
credit.
bad to say about CNAs, but
Right. Nothing bad about CNAs,
Exactly.
but recognizing that you think that they can only achieve so much. I
So
don't
much.
like
Right. 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 Yeah. Even sweetie, baby, honey. Sometimes you don't even speak, or it's not even making eye
I
contact with you.
was just gonna say,
that.
Right. Eye contact with you when you're talking, you're looking on your phone or paging someone. Again, doing your work, just doing good work at all times. That's been my saving grace. That's how I feel like I've been strong in this field is you don't have to like me personally as a person. You don't have to like my skin color, but I know what's best for my patient in my scope of practice. And I know I'm doing good work for my patient. So
Yeah, I appreciate hearing that. I hope that all of our listeners really resonate with what you said. It's just you put in the work and it'll show.
it'll show, right? It'll show, right? Regardless, it'll show.
So, given how saturated the field is with SLPs and being in the medical setting, how do you personally stay passionate about this field? What fills your cup when times are rough?
What fills my cup is, I think, definitely being a dualist or multifaceted minded in a person with the artistic mind. For me, I'm always when I feel like I'm hitting my plateau, I'm thinking, okay, I'm either gonna play this patient's favorite movie, we're gonna talk about his favorite song or her favorite song, we're gonna do a dance move, we're gonna do something. That's how I always fill my cup. By reaching over to the right side of my brain, which is the art and the fluffy and the flowers and the colors. I'm looking on that side and I'm saying, okay, what can I do to make it more interesting, right? What can I do to add a different layer? What can I do to make it more functional and fun? That's the word I like to use, functional and fun. So maybe we can, instead of Mr. Jones likes to smoke his cigarette, at 2 o'clock every day. Okay, Mr. Jones, we can go outside and you can smoke your cigarette. But after that, how about we meet for speech therapy and we listen to your favorite Marvin Gaye song? Something like that to just kind of improve the engagement of your plan of care or improve the motivation of the patient. Because for us, we can get so focused on our goals. If they're not meeting their goals, why are they not meeting their goals? Is it the goal or is it the patient? Which one is it? So a lot of times I like to just kind of just be like, okay, step out of the box with SLP for a little bit. Like just get out of the mindset of the goal. Get out of the 80%, 8 out of 10. Let's get out of it and let's look at the patient real quick. What does Mr. Jones like to do? He likes to smoke. He likes to listen to music. He likes to eat oranges. Okay, how can we use that functionally and fun to make therapy a little bit more better?
yeah.
So that's how I fill my cup, I guess, when it's half full. A lot of people like to say like CEUs and things like that. That's always fun, and that's always, of course, you can feed your academic mind, but your left brain can only be so much filled, and if the right brain isn't either. So how do you combat? You can be a learner, you can we'll talk about language. We can read, we can write, we can be type A, but everyone needs that balance of fun. Everyone needs that balance of fun. So, use both sides of the brain, right and left.
Yeah. So if you could take a time machine and travel back to speak to young Chelsie, young Esek, what advice would you have, or encouragement, or anything? What would you tell her?
I would say,
Or anyone in her?
okay, sure. I would say, Esek, start small. Start small. It'll be done because you're just a go-getter person, but start small. You don't have to attack the world in one day. I do have a favorite quote that I would love for little Esek to hear. Now it's Big Esek, and it's by an author named John Maxwell. My favorite quote ever. It says, "You'll never change your life until you change something you do daily. The secret of your success is found in your daily routine." God has, I'm going to read it again. Just read it one more time. Author John Maxwell. You'll never change your life until you change something you do daily. The secret of your success is found in your daily routine. That is what I would tell little Esek, that, changing something that you do daily will help you in the long run. If you look at the neck anatomy at least once a day now, Chelsie, that'll help you out long down the road, right?
Study tips, people get hello.
Right. Study tips. If you look at just knowing the tongue or looking the mouth or looking at just how many words of language in the lexicon a day, Chelsie, that'll help you out later on. Or if you may stretch a little bit longer in dance class today, it'll help you out later on. Trust me, it'll help you out later on. So that's what I would tell little Esek. Just start small. Just start with something small. If you want to be a better reader, if you want to, learn more about medical abbreviations, start small by reading just one word a day.
I think that's great. And I feel like people are, like, especially those grad or are coming from a different field into speech for grad school. They're like, how do I learn all these things? Like, how do I learn phonetics? You get all those questions, or like, how do I study for anatomy? But then they can be applied to so many other things, like you said, like even if it's like staying extra 5 minutes to do documentation a day, or
Exactly.
it's like it can extend to so many other things. Which is
literally. So that's the quote that I live by even till this day. Like I just okay. Every day now I make it apparent for myself to run, and that has helped me with my endurance and teaching class every day. Just one small thing I've done that's helped me along the way. So for sure.
Kudos to you for the running, because I can't.
So on that note, do you have any advice to share with those interested in combining their passions with speech-language pathology? Since I know that for you, it was dance, art, movement therapy.
I would say if you could do it, then do it. That makes you A, more marketable, B, a more holistic and well-rounded person, and C, your left and right side of your brain. There are people who wake up from different types of pathologies and can't use their right side of the brain, so they can't literally see color. Use that artistic. Everybody is an artist. Everybody can sing, dance, draw, sew. You can yodel. You can tap. Whatever you can do, make sure you bring it into not only your passions but your therapy, because patients want to see a person who's well-rounded. Patients just don't want to see a white coat or a scrub or a top and a book come in every day and talk to you. They want to see people. What else can you bring to the table? So I would say, yes, do it. Start somewhere. Let's say you like to cut grass and you like to be a speech therapist. Do it. Do it. Be a gardener and be a speech therapist, and maybe you can, touch a patient who likes to garden. Who knows?
Great. And then I guess our rounding out for this is, what do you see in your future as of right now?
Oh, Wow. In my future, I do see myself moving back to Texas. I don't know when, but I will be moving back home. I don't know if it's soon, whatever the universe decides for me. Um, and yeah, that's a new journey to reconnect with all my, Texas SLPs. I know there's a few on Instagram who I've connected with. But yeah, that's what I see in my future. I know it's kind of ironic that I started this new position and I'm probably gonna move, but I don't know. Maybe I don't know. That's just question mark. We'll see. We'll see where Essex Health goes next.
Somewhere in Texas, hopefully, is the
Somewhere in Texas, right? Somewhere in Texas, because I do want to be back home with family. My nieces and nephews, they're growing up fast, and I feel like I'm missing out a little bit. My partner of 10 years is in Texas, so I'm like, hey,
Oof.
right? Maybe after this year, or maybe after next year, I'll that's what I see in my future, being and possibly being on the Tisha board also. There are no minorities of color right now on the Tisha board, I'm sad to say. So hopefully that will be a plan of mine as well, to kind of diversify Texas as me and JRC the SLP did in DMV area. So
Nice.
we're trying.
Yeah, that's great. Well, thank you so much for being here. Do you have anything else that you wanted to say or add before we stop recording or sign off?
Yeah, just thank you both, Amanda and Karen, for this opportunity. The SLPs of Color is one of my favorite pages. Esek at Esek Health, ESEK Health, is my Instagram. You can shoot me an email if you have any questions about anything dance or speech related, at esektherapy at email.com. And also kind of shoot me on my website too. My website talks a little bit about how I can join half and half, my half worlds. It's eseklove.com. So again, thank you guys for this opportunity. I'm excited for this podcast to happen, and I hope we work together again sometime for sure.
Thank you so much for being here.
All right, y'all. Talk to you guys soon.
We would like to thank Chelsie for joining us on the SLPs of Color podcast. If you don't already follow us, you can find us on Instagram, YouTube, and wherever you listen to podcasts at SLPs of Color.
Make sure to follow, subscribe, give us a rating, and leave a review so others can find us. You can also leave us a voice message with feedback for this episode at 510-255-5620. Thank you.
Bye.